Hi, my name is Dr. Steve Miners of Rehab Effects in Austin, Texas, and today we're going to talk about diagnostic tests and studies. There are hundreds out there that we as doctors of chiropractic can refer a patient out for, depending on what the symptoms are and what we're trying to rule out. It's very important that we be aware of the various types of diagnostic studies that are available to us. That way it can help pinpoint or better pinpoint what will be in the patient's best interest to receive, as well as ruling out what the problem is. So we can send a patient out for x-rays, an MRI, a CT scan, blood work, or we can send them for, let's say, a hair sample or urine or saliva tests. Those three aren't extremely common, and I want to talk a little bit more about those. The reason why you would send someone for a hair sample, for example, is to rule out heavy metal exposure and to determine how much heavy metals are in the system. Also, you can rule out other environmental toxins that way. Urine and saliva samples, you can do the same thing, or you may want to perform a urine or saliva sample to rule out, let's say, certain problems that are going on, such as someone who is constantly fatigued and always aching and hurting. And when you perform a neurotransmitter test with urine and saliva, you can look at the neurochemistry, such as things as epinephrine, norepinephrine, dopamine, serotonin, glutamine, glutamate, agmatine, PEA. And those are all the neurochemistry or neurotransmitters that can then tell you more about what's going on with the body as far as its ability to function, its ability to handle stress. It'll tell you maybe about what the adrenaline